Module 7, Security and Privacy Training for Volunteer Assisters. The topics we will cover include the Volunteer Assister Access for HCA Community Partners, Threats, Information, Prevention Tactics, Incident, and Volunteer Assister Access. Volunteer Assister Access for HCA Community Partners. At the end of today's lesson, we'll share the final steps and how to become a volunteer assister with access to Washington Healthplanfinder. As we discussed in the previous modules, community partners with Healthplanfinder access have a number of benefits available to them to assist individuals and families with Apple Health coverage. To apply for access, community partners must be affiliated with an organization. Purpose. This training provides guidance on security and privacy practices for CMS and IRS compliance, and to establish a baseline of security awareness for working with the Washington Health Benefit Exchange's web portal, also referred to as Washington Healthplanfinder, and increase security and privacy awareness. What is security? When you think of computer security, think of CIA, confidentiality, integrity, and availability. In the information security world, CIA represents something we strive to attain to rather than an agency of the United States government. Confidentiality, integrity, and availability, or CIA, are the unifying attributes of an information security program. Collectively referred to as the CIA security model, each attribute represents a fundamental objective of information security. What is privacy? Privacy is an individual's right to control the use and disclosure of their personal information. Individuals can assess a situation and determine how their data should be used. Privacy is the protection of customers or individuals and their personal information, for example, health and financial information. Although security and privacy overlap in some areas, they are very different. Security is the protection against threats or danger, and privacy is the right to control how your information is viewed and used. The picture shows the overlap of protecting personal information. Both security and privacy have the responsibility to protect personal, confidential, and sensitive information. Security baseline questions. What is the purpose of this training? CMS compliance, protecting personal identifiable information or PII, and security and privacy awareness. Who is the weakest link in any security program? People are. Who is responsible for security? Everyone is. And what information is critical for us to protect? All information that we receive, particularly PII, personal health information, or PHI, personal care information, PCI, and federal tax information. Where should you store electronic WAPI information? On network drives or OneDrive? With whom can you share critical WAPI information? Only people that need to know. With whom can you share your password with? No one. Who would you contact if there is a security incident to report? Your HCA point of contact is HCA Volunteer Assister at hca.wa.gov. Security tips. Use secure network drives instead of local hard drives. Do not share your passwords or write them down. Do not post confidential or sensitive WAPI information on any social networking site. Erase confidential information from whiteboards. Protect PII as if it were your own, and practice need to know. Log out of systems before closing browser windows. Protect your access cards, laptops, and devices. Lock your computer. Use secure emails for sensitive information. Ensure that role-based training is provided for everything you are given access to, and know who to contact in case of security questions or incidents. Who is responsible for protecting personal information? Everyone who becomes a volunteer assister with Access and Healthplanfinder and users of information technology systems are equally responsible for security and privacy. You are responsible for the information you handle every day. It's everyone's responsibility to keep our systems and information secure. No one is exempt. Threats. Types of threats. Types of threats include social engineering, like phishing, spear phishing, tailgating, pretexting, or vishing. Can include insider threats, weak passwords, misdirected or unsecure emails, and oversharing information. These types of threats are not unique. Many public and private organizations with confidential information face the same types of threats. Remember, people are the weakest link in computer security. Social engineering uses persuasion or influence to deceive personnel into divulging confidential information or allowing the adversary to perform unauthorized actions. Examples include phishing, which are deceptive emails sent by bad actors, websites, and text messages that are used to steal information. Spear phishing, which is an attack that targets specific individuals or groups within an organization. And tailgating, when someone without proper authentication follows an authenticated employee into a restricted or protected area. Other types of social engineering includes pretexting, which is the use of a false identity to trick victims into giving up information, and vishing, which are urgent voicemails convincing victims they need to act quickly to protect themselves from arrest or other risk. Opening malicious emails. The impact of opening an attachment that is included in a malicious email can be very dangerous and expensive. The attachment may include a keylogger or install ransomware. Keyloggers steal personal information such as usernames and passwords. They take periodic screenshots, grab sent emails, or harvest credit card numbers and bank details. Ransomware is a type of malware attack that prevents or limits users from accessing their systems by locking the system screen or the user's file until the ransom is paid. Insider threats. Too often, people associate the term insider threats in cybersecurity with malicious employees intending to directly harm the company through theft or sabotage. In truth, negligent employees or contractors unintentionally cause an equally high number of security breaches and leaks by accident. Insider threats is defined as an insider using their authorized access, wittingly or unwittingly, to do harm to the security of organizational operations and assets. Information. Personal identifiable information. Per CMS, PII is anything that could individually or in combination with other data elements identify the consumer, such as a consumer's name, address, telephone number, social security number, marketplace application ID, or other identifier. Do not share client PII with others. Limit access and disclosure to authorized users or to those with a need to know. When in doubt, contact your supervisor or your HCA volunteer assister point of contact. Here's some examples of the different protected information collected. An applicant or person's information, such as their name, address, date of birth, social security number, ethnicity. A household composition, which includes spouse, children, dependents, relationships, medical conditions, income information. Plan enrollment, business organization name, enrollment history, citizenship status, and incarceration status, just to name a few. Some examples of sources of information include the Washington Healthplanfinder portal, paper applications, letters and correspondences, issuers or carriers, sponsorship representatives, and requests for Washington Healthplanfinder user accounts. Unauthorized disclosure penalty. Per 45 CFR 155.260, improper use and disclosure of information, including PII, is any person who knowingly and willfully uses or discloses information in violation of Section 1411G of the Affordable Care Act will be subject to a civil penalty of not more than $25,000 per person or entity per use or disclosure, in addition to other penalties that may be prescribed by law. User Access Agreement. The terms and conditions of this agreement will remain in effect after I leave my current position. I will not disclose confidential personal and financial information that I obtained while working in my position. I understand that any breach of any provision of this agreement will subject me to disciplinary action, including the immediate termination of my access to Healthplanfinder and termination of my position. Prevention tactics. Here are some characteristics of a strong password: using upper and lowercase letters, minimum of 1 special character, at least 15 alphanumeric characters long, and use passphrases to strengthen your password. Passwords do expire in 60 days, and they must be different than the last 24 generations. Never use personal information such as your name, date of birth. Never use the same password for all your accounts. And do not share or write down your passwords. Sending secure emails. All emails that contain sensitive or confidential information must be encrypted. When you need to protect the privacy of an email message, encrypt it. Encrypting an email message in Outlook means it's converted from readable plain text into scrambled ciphertext. Only the recipient who has the private key that matches the public key used to encrypt the message can decipher the message for reading. Incident. What is an incident? An incident is the act of violating a security policy. Incidents include the loss of data through theft or device misplacement, loss or misplacement of hard copy documents, and misrouting of mail or email, all of which may have the potential to put the data at risk of unauthorized access, use, disclosure, modification, or destruction. Violating an explicit or implied security policy includes these attempts: gaining unauthorized access to a system or its data, executing unwanted disruption or denial of service, obtaining unauthorized use of a system for the processing or storage of data, making changes to system hardware, firmware, or software characteristics without the owner's knowledge, instruction, or consent. Breach. What is a breach? An incident becomes a breach when there is the loss of control, compromise, unauthorized disclosure, unauthorized acquisition, unauthorized access, or any similar term referring to situations where persons other than authorized users and for another than authorized purposes have access or potential access to PII or federal tax information, whether physical or electronic. Common vulnerabilities include the casual handling of confidential information, loss or theft of laptop or the device. When including screenshots, make sure that no PII or federal tax information is visible, too much access, losing employee access badges, non-compliance with policies, procedures, standards, and regulations, and tailgating, as well as unauthorized or unintended disclosure of PII or FTI when sending unsecure emails or including too much information in help desk tickets. There's no need to put any client information found from other sources, such as phone numbers or addresses. And minimize putting PII in tickets by describing the problem, not the people. Using anonymous data, such as the application ID or person ID. Do not put social security numbers, not even the last 4, and never post any kind of user or individual lists in tickets. How to prevent an incident. Only discuss confidential information with those who have a need to know. Documents containing confidential information should never be left out in the open. Tips to prevent this include discarding in labeled or locked shredder bins, locking your computer screens, do not leave your work exposed in your work area, and always use secure print. Avoid emailing sensitive information, and follow physical and information security policy standards, procedures, and guidelines at all times. When in doubt, consult the WABI security team at security@wahbexchange.org. Publicly accessible information. All shared materials must not contain confidential content, such as PII, IT system settings, and consumer-specific information. Do not post company-specific information or consumer-specific information or PII on social media. For more information, visit this website at the bottom of this slide.
Security incidents in your role. If you see something, say something. If you become aware of an incident, contact WABI Security immediately at securityincidents@wahbexchange.org. Assisters, be sure to also copy your lead organization. Additional tip. Please do not directly contact the Center for Medicare and Medicaid Services or the Internal Revenue Service yourself.
Volunteer Sister Access. For Volunteer Sister Access and Washington Healthplanfinder, you must be affiliated with an organization and complete all 7 modules of the community-based training. Request a training assessment test at HCA Volunteer Sister at hca.wa.gov. Complete and return the test to the same email address. And upon successful completion of the test, HCA will email the Volunteer Access Registration Packet, which includes a Community Partner Registration Form, a Washington State background check, and Washington Health Benefit Exchange User Agreement. Once approved, you will be granted volunteer access in Washington Healthplanfinder and emailed a personal username and password. Washington Healthplanfinder account reminders. If there has been no activity on your Washington Healthplanfinder account in 180 days, your access will be disabled. And passwords for Washington Healthplanfinder expire every 60 days. Here we've listed some additional resources for HCA training and education, a link for HCA area representatives, a contact us email, and a link for the Washington Health Benefit Exchange. Congratulations, you have completed the full 7-module HCA community-based training. Please contact HCA at HCA Volunteer Sister at hca.wa.gov for the final steps to test and apply for Volunteer Sister Access in Washington Healthplanfinder.